Abel's story began shortly after Thanksgiving a couple of years ago. And I discovered a mass in his tummy and took him to the hospital. And we had an ultrasound done, and they found out that he had a tumor. And during surgery to remove the tumor, he coded, and his heart stopped for about 20 minutes, and he suffered severe brain injury from that code. And we went to St. Jude to have treatment. They decided that the tumor was neuroblastoma, and we had been through about 4 rounds of chemo, or actually I think it was about 3 rounds of chemo. Horrific side effects. Everything that could go wrong seemed to go wrong. Ended up in the ICU each time, often on a vent, and it seemed like everything just was falling apart with his treatment. Nothing seemed to be going right. And it was at that point palliative care began to get involved with us. He sort of began a very slow process, very gradual process with us of thinking about what our goals were with Abel. And he sort of outlined some goals with us in terms of where we focused entirely on curative intent. Was our goal at that point to get Abel completely cured of his cancer, going through whatever means that meant, bone marrow transplant, radiation, the full treatment, and doing that with sort of a secondary regard to his symptoms. And if symptoms became such that, as they had up to that point, they were a huge burden on us. Just watching him suffer and watching him go through what he was going through. Was there the flip side of that where you would say, we're not going to treat with curative intent, but we're going to do everything in our power just to keep him comfortable, whatever the outcome is at that point.
And it was a resident in this case, but it very well could have been an oncologist or any.
I know what you're talking about. It was a resident.
Yeah. And Abel was really struggling, and it was just one of the, for us, standard battles to try and get some help for him, some relief, some pain relief for him. And this particular resident said, well, you're his parents, but I'm his doctor, and I'm telling you that this is not going to be a good thing for him, and we're not going to do it. And that did not go over well with me.
Residents were very uncomfortable using those levels of morphine, and
it was a fight. I remember that. Less so after Dr. Kane and his team got involved, but definitely before they got involved, they were very afraid of giving us medication that would control his misery, and every single day it seemed like we had to fight with them over that. Well, we need some more pain medicine. Well, we can't give you any more because there are risks associated with that. And the assumption was that they weren't going to allow us to make that choice as to whether those were risks that we were comfortable with or not. So that changed somewhat after the palliative care docs got involved. So that was...
And our palliative care team was very clear with us early on. Here's the ramifications of these choices, but the choice is yours.
Well, difficult would be an understatement. It was very tiring because it was always a fight. Whoever told me no, then I always had to say, well, who's your supervisor? And then I'd have to wait however long, half an hour, maybe more, for that person to come
while Abel's screaming or throwing up.
While Abel is continuing to suffer, and I'm trying to deal with it. And then sometimes that person wouldn't be, wouldn't release any more medication, so we'd have to go up from there. So it was very it was a very emotionally draining experience. And it wasn't every day, but it was very regularly, particularly when he was in the middle of a chemotherapy treatment. It was unspeakably difficult for him. So, and by extension, of course, difficult for us. I remember, one of the things I remember most vividly about the palliative care doctor is when he met with us in a room and we had the conversation in depth about, what were our goals with Abel. And I learned that there's a range of treatment options. I mean, that should be obvious, but it had never occurred to me before that you would want to make the choice not to give food, or not to put on a ventilator, or not to give some other kind of treatment. And I mean, he asked us, is it important to you to be holding Abel when he dies? Is it important to you that he be at home or at the hospital? And, and we really had to think through those things, and it was something that I never dreamed that I'd be doing, but it was also something that needed to be done, and he was very compassionate about it.